Welcome. Thanks for coming. Today's program, as you can see, is mental health and wellness, connecting mental health and that wellness component into how your EAP can actually enhance that wellness initiative. And it's a good tie into this morning's openings by Kelly and Dr. John. You'll see a lot of tie-in there from comments they made as to what we're discussing today too. The next slide, just because I like this definition.
Hit the bottom button. There you go. It's left and right. Which one you hit? Hit the bottom button again. There you go. It's like reading left to right.
Oh, there we go. Thank you. So, mental health and wellness. This is a World Health Organization definition. But mental health is more than a mere lack of mental disorders. The positive dimension of mental health is stressed in the World Health Organization's definition of health. This is the part. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And when we look at so many of our wellness initiatives, we've got a lot of those physical things going on. We've been really great at that for a lot of years. We do the diet and the blood pressure and exercise programs. But when we talk about the mental health component, that's maybe an area we can definitely improve on. And there's a huge tie-in. I'm going to share some information and statistics, but there is a huge tie-in to the mental health piece. And I like the fact that it has physical, and it has the mental, and then there's even really the component of the social well-being. And Dr. John mentioned this morning about well-being, and if we think about our workplace, it says social well-being, but if we think of our workplace as really part of our social culture. So where does our workplace play a role in this mental health component, which we don't always look at? Next thing, you can call me Mr. Percentage probably for the rest of the conversation, but I did want everybody to walk away with some information and statistics to kind of validate the emphasis or maybe reapproach to mental health and how it fits in. But let's take a look. I'm going to talk a little bit about basically two subjects today, and we have a short amount of time. We could dive into a variety of different health issues on this, but I'm going to look at depression and especially going to look at some stress because that has a unique feature to it. But treating comorbid depression could increase adherence to interventions for chronic medical illness. An example there, it's been shown that depressed patients are 3 times more likely not to comply with medical regimens than non-depression patients. So think how that impacts your healthcare plan, your overall wellness initiatives. There's also evidence that depression predicts the incidence of heart disease. So it literally ties into the body and the wellness piece, that mental health component. Here's the percentages. So if we look at prevalence of major depression in patients with physical illness, you can see some pretty shocking numbers up there. So these are folks that have depression and have physical illness. Stroke is up 31%, chronic pain 46%, and we can do a whole program on mental health and chronic pain. Very direct correlation there. COPD up 24%, diabetes up 27%, cancer up 33%, hypertension up 29%. So some really significant percentages there. And how do we've got a lot of programs that address these things physically. How are we addressing the mental health component to that? Quick connection. I'll do 2 of these today. Quick connecting to the EAP. When we talk about depression, well, what resources do we have to bear? One of the first things you've got, and if you don't have, it's a really easy one to start, is your employee assistance program. Really, they're depression experts. We think of the EAP, lots of times people think it's drugs or alcohol programs. That's where it started, but it's evolved into so much more. It's really a whole approach to counseling. And certainly depression is one of the major items that people access the EAP for. Kind of some reasons for that: ease of access, inconvenience. It's something they're usually familiar with. They've been part of the organization a while. Maybe they've seen that before. It's kind of a trusted resource. Convenient. Again, I'll use our program, Help People, for an example. We have 3 offices in this area, so people can get access real quickly. Our appointments are real quick, as opposed to a lot of other mental health resources where you're on a waiting list, or it's just really hard to get access. So with the EAP, they have mental health access almost instantly. No financial insurance barrier either. That can be, and we've all experienced, that can be a challenge. filling out forms, or who's provided, or who's part of the network, where's the copay, and all these other items that come in. This is employer provided. The employee doesn't have to pay. It's just instant access without all the bureaucracy piece. With that too, there's a confidentiality piece that's not always emphasized as much. The EAP emphasizes confidentiality a lot. And if we look at even people accessing the insurance world, where does their data go? What system am I in? What electronic information is out there on me now? Where the EAP, at least ours, is we're not connected to anybody's network or anything like that, so your information is confidential. Comfort, maybe less stigma. Well, you can go to the EAP for a lot of reasons, and it's been available. And other people in my workplace has gone. I hear people talk about it. There's a different comfort level. Education and direction is another opportunity. I have a couple things here. These are just simple handouts. But we have a depression handout that we bring to the employer, the benefit fairs, or cafeteria. We have a stress checklist. Those can happen through training seminars, wellness seminars, benefit fairs, printed information, phone calls, anything. It can just be an education resource for folks too. Generally, it's non-prescription. Right here, again, it's not medical. We're not, and most aren't, but I did put generally up there. So when people are coming in and looking more kind of real-time approaches to depression and working on some solutions right away, and really having that counseling feel. 77% of depression prescriptions are written from the doctor's office. And we all know that primary care doctor has 7 minutes, 9 minutes, you're there for an ankle injury or something, and all of a sudden depression comes out, or the employee, and then all of a sudden, hey, the quickest thing to do is write a script. Lots of times it never gets to the core issue of depression, which really counseling can have a big impact on. Service extends to family members. That's another big component too. So many of our wellness initiatives, we capture the employee because they're there at work, but with our healthcare plans and some of our financial impact, obviously family members are on there. So the EAP, and again, depression is going to reach, and all the mental health issues are going to reach right to the family. So quick slide on the mental disorders when it comes to family members. We don't, it's kind of sometimes hard to have numbers associated with that, but I think the common sense is there, and the fact if employees suffering depression, it's going to have an impact on the rest of the family. The EAP can make that connection. Family members, again, in our program are eligible to come in for that too. So that's quick, a short amount of time, but if we take a look, we see what, and you can look at your healthcare numbers. You can get them out, see what psychotropics are in your cost in your healthcare plan. Significant. Plus all the other factors that you saw rolling. Depression is just one area where the EAP can almost instantly start to help you with that. I think there's a lot of other great approaches. I think an EAP is step one because you can get it going right away. It's easy to access. If you have it, you can dial it in more. If you don't have it, you can start it really quickly. The next one, and again, I think there's some really interesting tie-ins from some of the openings this morning, but let's talk about stress, workplace stress. This definitely has a unique feature to it. Some statistics there, again, being Mr. Percentage. Stressed workers have a 46% higher healthcare cost. Says a lot right there. Stress-related distractions or sleepiness account for an estimated 60 to 80% of accidents on the job. Think of how that impacts, workers' comp and overtime and covering shift and down production or anything like that. That's a significant cost. 1 million workers miss work each day because of stress. 1 million a day. The average is about $602 per employee per year. So again, these are the cost justifications I'm throwing out there to you. Stressed workers have an elevated risk of mental health problems ranging from anxiety, substance abuse, and depression. So stress is absolutely an issue when it comes to our healthcare. It's largely starts or has been the treatment for that is largely residing in the mental health field. And again, your EAP can be a quick part of that. I like this. This kind of came up briefly this morning too. So we, stress is there. Our employees are stressed. They're costing. They roll into our wellness programs or impact our cost programs. And don't worry, they're going to cope with it. No problem. So this is all good, right? They'll self-cope with it. Yeah, 40% will smoke, 41% gamble, 35% shop. Those are financial impacts. 27% drank alcohol, 26% ate, 12% gained more than 20 pounds. So stress, health, direct connection there. Yes, they're going to cope and impact the healthcare plan morning. Dr. John did some good correlation with that earlier this morning. This is my passion piece here, and in fact, stress is different. 66% of the workers say that work is the main cause of stress in their life. So that way, it's a different component. 75% of American workers report experiencing physical symptoms of stress due to work. So all of a sudden, work now is the component. That's why I have my pretzel there. Unfortunately, it's a salted pretzel for a wellness event. I shouldn't have done that, but it's intertwined. So the employer, when you think about the work experience that was mentioned this morning, the employer is actually creating this. This is different in the fact that, if it's a weight loss issue, here's the employee with weight loss, here's our programs, whatever it may be, and there's this linear connection. Like we heard this morning, trying to influence that or whatever it might be, there's this connection piece. Well, the stress in the workplace is different because we're actually part of causing it. I mean, to correlate that to the physical things, I don't think any employer here is going to win an award today for Fried Chicken Fridays, or all you can eat donuts, or smoke, whatever department smokes the most is going to win a prize, But with stress, we are doing that. We, as the employer, we're actually doing that. So there is, some opportunities for us to look at stress different. In a positive way, again, it's one thing we own. There's a direct correlation there. So a little, just a kind of a deep question, but does your organization create stress, ignore stress, or manage stress? Kind of the trick in there, obviously there's some stress associated with work. I mean, there's things that need to be done and tasks and priorities, but do we do more? Do we create more stress than what we need? I can think of an organization that always had these Monday morning meetings, and through some dialogue and some conversation, people were very stressed. They ran late to that meeting. They weren't prepared. It was just very stressful. Why? Because you know what payrolls do at 9 o'clock on Monday morning. So at the same time, they're trying to get payroll done before they get to, and then they're calling people. Well, if we push that meeting just back to 1 o'clock, it was like, oh great, I can be prepared. So sometimes simple things. We're going to talk about some other things too, some environmental things. Do we ignore stress? Like, come on, most organizations do. If we look at some generational things, we talked this morning about baby boomers and things like that. Well, come on, that's just part of the job, Well, we just ignore that. Or do we manage stress? And I think that's where we can go as an organization. How your organization can manage some stress. And I wanted to pick some different things. I know there's organizations, and you'll see some today, award winners, hey, they've got some yoga, they've got some quiet rooms, got some meditation, different programs. Exercise itself is, a stress reduction. So there is things that are going on, but I wanted to pick some other ones that can be a little bit different. Dr. John spoke this morning about the workplace experience. To me, this is this slide, or at least some components in here to be part of that. So do we ever look at our workplace experience? Probably we don't. We just go to work every day, and we just do it the way it's always been done and just accept things for how they are. Perform a stress survey. That sounds, maybe never even heard of that. It sounds kind of different. What do you mean by that? It does have to be well worded, but we don't ask our employees, what causes you stress here in the workplace? Yeah, if you word it correctly, you'll get some, if you just are like, well, if that's your only question, you'll get a lot of interesting information. But if we kind of take a look at some opportunities to ask a little bit more close-ended questions and get some feedback from our servers, or even just the opportunities for one-on-one open dialogue, but actually see what, you'll absolutely be surprised at some of the feedback you get from a survey, a stress survey. Call it something different, by all means. Evaluate the physical environment. I see this a lot, and I think you can, as you go out, you'll start to see this as you go into different workplaces, even as a consumer. A couple things I saw recently. There's just a good old fast food place. Yeah, I shouldn't say that, a wellness thing, but I was there. Ordered the chicken, but oh my gosh! All of a sudden, there's bells and buzzers going off. My anxiety. I'm on the other side. I just want my chicken burger. And I'm starting to get tense and upset, and I'm worried about, well, why is this going on? Why is this going on? So all these sounds in this environment were like alarms going off. Another place went to the conventional kind of doctor's office type scenario, and there's somebody at the front desk, and guess what? They're trying to address me. They're on the phone with somebody else, and there's a coworker tapping them on the shoulder and back to take care of this thing. I felt stressed for this person. So really, that environment, the physical environment, the work order environment. Another one I've seen in some work environments that's starting to be my passion is TVs. Employers have now put TVs everywhere. I went to a place where they have a nice quiet, over in this corner of our break room is this quiet area with a leather couch and a plant. That's nice, and I agree with Dr. John, if the culture doesn't support that, that's just a couch and a plant. But what I thought was more interesting was the fact there's a giant TV just kind of over a little bit to the left. So as I'm in this room, a couple workers come in, there's something about the political candidates on. Well, they started debate almost about that, totally not relaxing or not stressful. They actually kind of start to go back and forth, and then 10 minutes later, it's about a hurricane moving up the coast, and a couple people come in and like, oh, geez, here we go, I'm like, this is, why are we bringing that TV into our workplace? So we look at the physical environment. Job shadow, I think another neat idea. Lots of times, people have been doing their job so long. That person at that doctor's office who had the tap on the shoulder, 3 phones ringing, and 4 people in just is dealing with it because that's the way the job's always been. I'm sitting there as an observer going, wow, this could be redone differently. So sometimes can we have somebody job shadow, pick somebody with some knowledge, maybe your EAP folks could even come do that. They're nice and neutral. An intern or anybody like that to just kind of go through a day with somebody, and instead of picking out the task things, pick out the environment things, because people won't always see them. Flex schedules, I know that's nothing new, but I continue to read statistics. Again, back to generational things, especially with millennials and stuff. Flex schedules are huge. You look at every data, every survey, people becomes part of the environment. So if you haven't looked at it in a while, that was real jazzy for a while, and I think maybe some people are like, yeah, well, we do that, but it's probably something that was done a long time ago, and it could be looked at again. In financial education, I mentioned 2 of those statistics. People cope with things with gambling or shopping, but there's a lot of financial education out there that you can bring into the workplace. Make sure it's not sales pitching. And it's not high-end. It's not, should I invest in the diversified funds or the international funds? Not your 401k provider, but necessarily just somebody who can provide good financial education for employees. And there's a lot of good ones out there, and you're happy to connect you to them. So last slide basically there is, again, we're EAP stress experts. We do the counseling, we do stress management skills. We're workplace-based, so we know we're about the workplace. I've covered the ease of access, covered the financial, education and direction, and again, it extends to the family members. So you've got a resource that you can instantly start to dial in for this. Conclusion, truly succeed in our wellness mission. Mental health of our employees is a critical area for us to provide meaningful resources. So again, sometimes we've done a few of these things, but we can really start to do a lot more. And even EAPs, to me, first step 1, and there's even more steps in the future. And your EAP is built around providing mental health resources for your employees, include and promote this valuable resource into your mission. And that's it. Thank you very much. If you have any questions, please stick around. All right, we're done filming, so now you now I can be real. But no, thank you for coming.